welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Alzheimer's disease is the most common form of dementia, with an estimated 7.4 million Americans 65 and older living with it. But treatments are undergoing an explosion of research, with a record-breaking 158 new drugs being evaluated in 192 clinical trials. Some of those trials are conducted right here at the WVU Rockefeller Neuroscience Institute. Dr. Joseph Malone, a neurologist specializing in memory disorders at RNI, is with us today to talk about new Alzheimer's treatments, new ways of detecting the disease, and even ways to help prevent it, all of which are creating new hope and excitement in the field. Welcome, Dr. Malone, to Live Healthy West Virginia.
Thank you, Mary. It's an absolute pleasure to be here. Big fan of the podcast.
All right. That's good to hear. Well, I think we need to start with a little refresher about, I think there's a lot of confusion over dementia and Alzheimer's disease. So let's just start with, what is Alzheimer's disease?
Absolutely. And this is even confusing amongst physicians and the research community at large. But Alzheimer's disease refers specifically to the buildup of abnormal proteins called amyloid, which forms the plaques that most people are familiar with, and tau, T-A-U, which forms tangles.
Okay.
These proteins build up in the brain, and when they do, they can cause disruption of the neurons and ultimately death of the brain cells, which ultimately could lead to the symptoms that we see with Alzheimer's disease.
Okay. So, as far as dementia versus Alzheimer's, what is the difference between dementia and Alzheimer's? I think that's another confusing point.
Yes, Alzheimer's is so common that people ultimately are going to interchange Alzheimer's disease with dementia at the common level. But Alzheimer's disease refers to a specific type of cognitive issue and can lead to dementia later on. Dementia is kind of a vague term that just means that your thinking problems are such that you're no longer able to do things on your own independently. And this is something like driving a car, doing the finances, managing medication. But dementia can be caused by a whole host of things. Like people who've had strokes can have dementia, long-term alcohol use, drug use can all cause dementia. But Alzheimer's is the most common cause of dementia worldwide.
So is Alzheimer's a kind of dementia?
It's a change on the brain that can lead to dementia over time.
Okay. Good to know. All right. So here's another big point of confusion. How do you know if it's Alzheimer's or just, I'm getting older, I'm, not remembering a lot of things the way I used to?
This is important because this really helps distinguish between what is normal versus do we need to act sooner, especially with these new treatments we're about to talk about later on. Mm-hmm. But typically when people get older, normal, quote unquote, normal changes include things like difficulty remembering names, particularly people that you're less familiar with, like old acquaintances, people you went to high school with, you're not around with anymore. Or there may be the occasional lapse in forgetting what kind of word to say when you're talking with someone. Now, when we get into more of the Alzheimer's realm of problems, we're talking about issues on a frequent, typically on a daily level, where people are repeating themselves, asking the same thing over and over again, like a broken record, and they're not aware that that's going on until someone brings it up to them. Or they may misplace objects more frequently around the house, particularly things like car keys or wallets, and this becomes much more frequent than, say, once a month or twice a month, things of that nature.
Okay, so we'll see more of that. What are the early signs and symptoms of Alzheimer's?
Yes, so most commonly Alzheimer's disease tends to affect the memory centers first. We call that the hippocampus. And that's where a lot of our memory abilities are maintained. And that's where people often will start to ask the same question over again, repeat themselves. They may forget something that was told them. They may forget things that they learned before that they're familiar with. These are really the key memory issues that we see. But Alzheimer's disease can also affect other parts of the brain besides memory. So we often will see people have word finding difficulties. They may have difficulty orienting themselves, particularly with driving, kind of forgetting the familiar environment, how to get to the post office or church. We'll see that often. And they can even have mood problems. And this is an under-recognized issue. People who have never had depression or anxiety before, and they start developing that later in life, like in their 60s, that may not just be, oh, I'm depressed or I'm anxious. It could be that may be the earliest change we actually see in the beginning of Alzheimer's. Exactly. Yes.
Oh, wow. Okay. So there have been some new treatments. I mean, like this is like exploding. It's taking off, right. which is very exciting. And just full disclosure here, I have a family member. You're his doctor. And he was diagnosed it'll be 2 years ago in September with mild cognitive impairment caused by early onset Alzheimer's. And he had some mild symptoms, but we didn't, really think of it as that. We thought, well, let's get a check to make sure. He is on one of these new treatments, and oh my gosh, what a difference. You wouldn't even know that he had this diagnosis if you weren't told. He's still working, he's still driving, he's still, babysitting, he's, still leading his best life. And one of the treatments that he's on is these monoclonal antibodies. Now, I don't know if we want to start there, but that has made a huge difference. I mean, I know that the original promise was this Leqembi, which is, monoclonal antibodies, and you get them through infusion. Over the first 18 months could slow down the progression of the disease by about 30%. But we feel like the treatments have kept my family member right in its place, right where he was. It's like, and there's even been small improvements. I know that's anecdotal, but I'm really excited about it, and I can't tell enough people about it, but I'm going to let you talk about that now.
Thanks for setting that up. I appreciate it.
Seriously.
The landscape of Alzheimer's treatment has changed drastically with the rise of these new medicines. Alzheimer's was first really established back in the early 1900s, and it's been over 100 years plus until we've actually had something that can actually slow down the progression of this thing. These medications, as you said, are monoclonal antibodies. What does that mean, right? They're if you think of an antibody, we normally make antibodies in our body whenever we get sick or there's a bug in our system, and they go and attack the infection. These are antibodies that are designed towards the plaque, which is caused by that amyloid protein I was referring to. So we also call these things anti-amyloid therapy because they go against that plaque. And for a lot of patients, we have a significant eradication of the plaque in the brain over the initial 18-month duration of the medicine he's on called lecanemab. As of 2023, there are 2 FDA-approved medications that we use now. There's lecanemab and then there's donanemab. And they both work very similar to each other in removing that plaque. But as you alluded to before, these medicines help slow down the progression of the disease. Now, I'm not saying it's a cure, because it's not a cure. Mm-mm. However, slowing down a disease like this is important because that gives you more time in a milder stage, which means more time being you, being able to do what you want, like babysit, drive, live your life. And that's really, I'm glad that these are around, because these are probably hopefully these are the first of many promising therapies down the road as well.
Yeah, and the findings have even improved with the research. I mean, R&I was what I think when he was diagnosed was one of only 8 facilities that were using these treatments. And it's just made such a difference. I just can't say enough about it.
And I don't want to fall into the trap of saying too much good things about it. However, but to your point, the data from the past, we have about 3 to 4 years of data now that these medicines have been out on the market. And the data is suggesting that people who've been on it, even for that time frame, as long as 4 years, the disease is still being slowed down, which is tremendous. But that benefit, though, Mary, is important because that benefit is mostly seen when people are treated sooner and have milder symptoms. And that's why really making sure that make it for early diagnosis and detection is so critical now, given we have these therapies.
Yeah, it is most effective on the earlier you are, the better the outcome, correct?
Exactly, yes.
Yeah. And is there a point where you're just too far along for treatments like this to work?
That's a great question. It's a fair point because we, as physicians, we always need to weigh the risk and benefit of treatment.
Right.
These medicines, I mean, they're great and all, but as every medicine, they have side effects. And the side effects for these medicines in particular, the anti-amyloid therapies, are brain swelling and brain bleeding. And there are certain people, once you get to a certain point in the dementia, that the brain bleeding risk outweighs the benefit because you're progressing at a faster rate than the medication can slow down.
Okay.
And at that point, we'll probably be doing more harm than good. And it's best to continue to help that person with other treatment options.
Okay. I'm going to say one more positive thing.
Sure.
When my family member was diagnosed and he started on that, and we were lucky, he didn't have really any side effects. We lucked out. We did. Because I know some people do. But I remember we were told that, if we are finding that we can give you 3+ years of preserving your cognitive function. And after he'd finished the 18 months, you told us that now we can preserve cognitive function for 8+ years. That's huge.
It's huge.
It's huge.
Right. It's big. And now, once again, I want to take a little bit of grain of salt with this preliminary data. But for people such as your family member who had a low amount of the plaque to begin with, the data seems to suggest that we can get probably 6+ years perhaps of staying stable as opposed to just 18 months or just 3 years that was previously seen.
Right.
But that's huge. Nothing does that at this time.
So, and I also think that points to the importance of, if you even have the smallest suspicion that something's going on,
yes, go
get checked out. I mean, that can make all the difference, right?
Absolutely. And this is an important point because oftentimes that when patients go to the doctor and mention something like this, they might be the can might be kicked down the road.
Yeah.
And that's fine. Family doctors, PCPs, they're extraordinarily busy. But if you want, it doesn't hurt to always go and get a baseline assessment if you're feeling that your memory is not what it used to be.
Yeah. You can't wait for it to get better on its own.
That's right.
Because it's not. Now, this is one of the treatment options that have taken off over the last 5 years. Are there any other treatment options? What gives you the most hope? What do you think is the most promising?
Sure. As I kind of allude to, these medicines target the amyloid plaque.
Right.
But that's only one of the two big components of Alzheimer's disease. And Alzheimer's is unfortunately, a little bit more complicated than just these two proteins. There's inflammation going on. There's problems with the blood vessels in the brain. So our hope would, at the end of the day, there's what we call a multimodal approach, where we're targeting different things all at the same time to try to help kind of quiet this down and reverse it, ideally. So the next step, probably the most promising treatment would be to use an agent that targets the tau protein in addition to the current anti-amyloid therapies to kind of as a synergistic effect. So they kind of work hand in hand together to combat the disease.
Are we inching toward a cure?
We are now more than we were 2 years ago, I think.
2 years, just that much progress in 2 years.
And based upon where I trained and where a lot of the dementia specialist trained, we hang on to the mantra that the person who's going to be cured of Alzheimer's disease is going to be in a clinical trial. And that's why, because those clinical trials offer the most hope and target the most important parts of the disease, that we hope we will see a cure, or at least a huge reduction in the disability of the disease in the near future.
Excellent, excellent. So what's new? What's new on the horizon in treatments?
Yeah, sure. So this actually ties into what I was talking about, that multimodal approach.
Yeah.
So we have medication. Now, medication is great and all, but as I mentioned, medication has side effects.
Yeah.
There are these new approaches called neuromodulation. And here at WVU, we are kind of on the forefront with that in multiple areas of neurology, also with addiction. But one of the things that's actually going to be clinically available, we hope to be soon, are what we call the cognito goggles. And I don't know if you all have seen like the virtual reality goggles that exist for like Facebook, or we're playing video games. But these are things you put on your head and on your ears, very sci-fi looking, and they essentially beam sound and light at a certain wavelength into the brain. That kind of helps keep everything on sync and helps improve cognitive performance.
No incisions, nothing.
No.
Just wearing. And how long do you have to wear the goggles? Do you do this every day?
It's going to be at least on a daily basis and to a certain time frame, but it's kind of tailored to the individual. But this is really kind of we hope to actually use this in addition to the current anti-amyloid therapies down the road. So this is very promising.
This is another big one.
Another big one.
No surprise that R&I blows your mind on a regular basis. I always say that. So let's talk about diagnosing Alzheimer's, because there's been some advancements in the way you diagnose Alzheimer's.
Yes.
What kind of advancements?
So this has gone really well with the fact that we have these new treatments.
Yeah.
And like I said before, early detection is critical. So we need to find a way to detect folks earlier. And unfortunately, one problem with Alzheimer's diagnosis is that we have to use these kind of these fancy, costly scans called a PET scan, PET. Mm-hmm. These PET scans are only found in certain places. So folks who are, we have a lot, of course, West Virginia has a huge rural population, as we know, and getting to these kind of places has a lot of access issues and equity problems. We're trying to improve that on our front. However, one of the more promising ways of detecting it to facilitate the diagnosis is with just taking some blood and sending it off to the lab, and we can actually detect that amyloid protein and the tau protein in the blood.
In the blood?
In the blood.
Wow.
Yes.
That's a big deal too. And that's relatively new, isn't it?
Yes, it's just now the first FDA-approved blood test for Alzheimer's was approved back in May of this year. So it's really only in its infancy. However, we had to be careful with this because there are multiple labs out there and there are multiple types of tests out there. So and not all of them fit the FDA grade of detection.
Okay.
So you want to be careful. But that's why I'm working with WVU at large through neurology and at the level of the primary care physicians to make sure we order the right one and know how to actually interpret it as well. Because one thing we don't want people to do is just order this randomly and not know what to make of the results. Because this test cannot be used in someone who has no cognitive issues. You have to have some form of symptoms in order to get this test ordered. Yeah.
So this isn't the kind of test that will predict whether you are likely to get Alzheimer's. This is one to just straight out diagnose if you're already having symptoms.
Right. And in that point, it's what we call a screening test. So someone needs symptoms, and then you can screen them for the underlying Alzheimer's disease by this test.
Okay.
Now, in clinical studies and research, it's shown to be good for trending people over time if you never have symptoms. But that is not ready for the clinical arena yet. That still requires a lot more validation before we say, hey, let's just check this blood test on this person and see and predict if they're going to get Alzheimer's down the road. But that kind of level of precision may be coming up in the next couple of years, actually.
Is there anything for people that, their parents, they've taken care of a parent with Alzheimer's or a grandparent or a sibling. but they're younger. I mean, is there a test that can predict, a likelihood that, well, you could get Alzheimer's because is there a genetic factor to Alzheimer's disease?
It's a good point, and the answer is a little bit complicated, but let me flesh out a little bit.
Okay.
Most cases of Alzheimer's are what we call sporadic, which means it kind of just happen. Okay. And maybe a combination of several environmental factors, things that kind of happen throughout the course of your life, with a little dash of some minor genetic alterations that kind of push people over the edge once you reach a certain threshold.
Okay.
So that means that, so I know how Alzheimer's is very common. I've had a loved one with Alzheimer's, and then just because you have a family member with Alzheimer's doesn't mean you're going to get it.
Okay.
So that's reassuring on one hand, but also makes predicting it very difficult. But there are certain things you can do younger that helps reduce your risk of developing Alzheimer's and dementia in general, for most major causes of dementia, actually, which is incredible. But to your point, and I'm going to talk about that in a moment.
Okay.
Routine genetic testing in individuals who have a loved one with Alzheimer's disease is not actually recommended, with one exception. And that's if you have Alzheimer's symptoms in your 40s or 50s. That's really young.
Yeah.
People in their 60s and above, that's fairly classic of the disease. But unfortunately, we have patients who have these single point mutations in certain genes that cause them to have Alzheimer's in their 40s and 50s. In that situation, you want genetic testing at that point.
Okay.
And we're blessed to have we actually have a great geneticist as part of our team, Dr. Psychogios. I'm going to shamelessly plug him. He's been great. His team's wonderful. We send it to him all the time, and he really does a great job with that genetic counseling and ordering those tests for us.
So if you have a relative that had gotten early onset Alzheimer's in their 40s and 50s, you should get screened in your 40s and 50s?
Yes, under the guidance of someone like myself, I think it might be ideal.
Right.
But look, to give you an example of what I'm talking about, we have a case where there's been a clear, one parent had it in their 40s, died in their 50s, and then another family member, 40s and 50s. That's extremely rhythmic and a huge red flag that there's an underlying genetic cause that needs to be further evaluated. Okay. One reason for that is there's a lot of initiative going on for research into those kind of mutations too. And so they'll actually qualify for a lot of the clinical trials going on in that field as well.
Wow. There's just so much going on
there's
in
a
this
lot.
field.
It can be overwhelming, but it's it's
all
wonderful.
good.
Absolutely,
yeah.
yes.
Yeah, it's great. It's great. Why is early detection so important in Alzheimer's?
Yes, the most immediate reason, for the most practical reason right now, is to get people treated on the anti-amyloid therapies sooner rather than later. This probably will play more role in terms, once we get more into precision medicine, be able to kind of take this information and predict that at an individual level, their likelihood of getting Alzheimer's disease, which, like I said, is probably not far off down the road, actually.
Oh, wow.
So that's, but that still requires a further refinement in clinical studies. But that's probably what the future is going to be entailing, for individualized brain health assessments to determine one's own risk and an individual pattern treatment for them. Okay.
So what about prevention? What can we be doing right now to prevent getting Alzheimer's?
So when doctors say these things, we're not saying them for our health, okay? But you're going to be hearing a lot of this is a little bit preaching to choir, and these are understandably they're kind of common sense, but they pack a lot of punch though, and this has been proven time and time again.
All right.
But by far the single best cure-all, if you will, or treatment of preventing for the development of dementia is staying physically active. I can't tell you that enough. And now I know that sounds like, oh, that's just the boring doctor answer, but let me tell you, this has shown it has antidepressant effects. It reduces the inflammation in your brain. It helps restore the blood flow, and that's really important to help get rid of all that nasty plaque and tangles out of your brain. This is extremely important, but the importance really lies in doing it younger. If you already have symptoms, now it's very important to do it still then.
Yeah.
But the great benefit is doing it proactively, early on, 30s and 40s, kind of like that magic window. You want to start doing that stuff. Diet. As you all know, the American diet is not particularly conducive to...
No, it's not. It's not conducive for anything.
That's right. That's true. Yeah. And so one diet we recommend is called the Mediterranean diet. And really, what boils down, why that diet is so successful really is because of stuff God has already given us. Natural foods. Seafood in particular. Salmon. Salmon is rich in omega-3. Now, I know not a lot of people like salmon, but if you take omega-3, that's a good alternative. But taking things that are naturally occurring is really the key.
Yeah. Fruits,
vegetables, things that you can find readily. That's why that diet is probably so effective. Another thing that people often don't think about that I'm going to throw out here is oral hygiene.
Oh yeah.
Okay, I'm not a dentist. Okay, but okay. So, and I gotta say, dental education in med school is not the best because teeth. It seems like teeth and everything else is kind of dissociated with medical education. But I can't tell you because the bacteria that builds up in your teeth can get into your bloodstream and go to your brain. And
just like it does for your heart.
Exactly.
They've connected heart disease to
bad. It is all connected, teeth. Mary, and that's why you need to go see your dentist to do routine cleaning to start off with. Floss your teeth. This is a neurologist telling you to floss your teeth, by the way. Okay, this is crazy stuff. Okay, but this is
gotta
good
listen
for...
to this.
Yes, but it helps not only with Alzheimer's, stroke, anything that causes a lot of inflammation in the brain. Taking care of teeth is also vital.
Okay. All right. That's one I haven't heard, actually. So that's another new one. But I mean, it's all within our own power.
Absolutely,
I mean, we can control our destiny, right?
Yes.
That's good to know. That's good to know. So let's talk about the depth of experience in the world-renowned team at the WVU Rockefeller Neuroscience
Right.
Institute. I mean, how lucky are we to have this in our front yard? I mean, and I'm not using the term world-renowned loosely. I'm not. I'm not. Here it is, right here in West Virginia.
Yes.
Let's talk a little bit about that. I mean, I don't
Sure.
think a lot of people realize what a benefit we have here.
No, Mary, this is coming from someone. I went to undergrad here. I went to medical school here.
Mm-hmm.
The R&I, the Innovation Clinic, was not part of that education. And having come out of fellowship and dementia training, seeing this, it blew my mind. I thank God every day that we have something like this to help my fellow West Virginians in the state. But not even that, but as you said, we're helping people all across the country and the world. Every main major memory hub in the country tends to have a focal point of what they focus on.
Right.
Here, as people may be aware of, is the focused ultrasound
Mm-hmm.
with the blood-brain barrier opening and what we call neuromodulation, which is kind of the big term for all those different types of things, like the cognito goggles and then doing the ultrasound studies.
Right.
We're looking at different patterns of using that to explore, help people not only with Alzheimer's disease, but other forms of dementia as well. Like
Okay.
things like frontotemporal dementia, dementia with Lewy bodies, which are very common as well, but often kind of get underdiagnosed because of how prevalent Alzheimer's is.
I mean, and this is a team assembled of the best from all over.
Yes,
right?
we cannot. This is not a solo project. It cannot be done solo. There's
It's
so
a team
much.
sport.
Oh yeah,
Mhm.
there's so much that's required of this. There's so many different treatment options available. You have myself as a neurologist, but we have a great what we call neuropsychology team. They're the ones who are very important because they can help detect very subtle cognitive signs that may be missed by myself even, or like just conventional screening tools.
Sure.
We have great neuroradiologists to help us with the MRI interpretations. We also have geriatricians who are specialized in older adults. We also have one person I want to shout out is Dr. Stephanie Pockle, who leads our neuropalliative team. This is very important particularly for people who are on the end stages of dementia and need that extra degree of support, help with the forms and the legal kind of quagmire.
Yeah.
She is an excellent resource on that, and I'm very thankful to be part of this whole team here.
Wow, that's so exciting, and it's right here. I always say it's in our front yard. It's
That's
not our
right.
backyard. So before we go, I always like to ask, what's the most important thing you want our viewers and listeners to know about advancements in Alzheimer's disease?
The advancements that are here require early detection, and I can't stress this enough. If people are feeling that they're having problems, it doesn't hurt to get checked out, because you won't be able to get access to these things unless we help diagnose you. So do not have a low threshold for asking your physician or your primary care doctor to get a referral, and we can check you out and see if you're eligible, because time matters.
So early detection, and there is so much excitement in what's going on. The future looks bright, doesn't it?
Absolutely. There are so many things that are currently in the pipeline that will be readily available, hopefully in the next year or two.
Wow.
Which is fantastic.
Yeah, that's good to hear. That's good to hear. Well, thank you so much for sharing all this information with us. I think we've helped a lot of people today, and well, I'm hopeful, and I'm hoping to spread that hope. It's real. It's real.
It's my pleasure, Mary. Thanks for having me.
Thanks for being here. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on Alzheimer's and other memory disorders, visit wvumedicine.org/RNI. To find the latest episode of Live Healthy West Virginia, follow us on our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist. Or search WVU Medicine to follow us on Spotify and to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Malone and everyone at WVU Medicine, thanks for joining us.